questions about breast augmentation surgery.
Excellent.
And I was just wondering, my first question is there any way to have implants and still keep natural looking breasts?
Absolutely. Yeah, I think a lot of times there's a misperception that having implants is going to necessarily make it look like you have implants. That's not at all the case. You know, there's a wide range of outcomes that are possible for any individual patient. And so understanding what you want to look like is an important part of the consultation process. You don't have to look like you have implants to have them.
Okay. And can you explain the difference between silicone and saline implants?
Yeah, these are all really good questions. I get asked these questions all the time. You know, there are differences that have to do with how much the implants cost, and there are differences that have to do with the outcome you could expect and the maintenance and things like that. One thing that needs to be said right off the bat is that they're both safe. There's no difference in the safety of silicone versus saline. There's no reason to be worried about your health over the long term, whether you choose silicone or saline. So the differences have to do with how much they cost, how much follow-up is involved, and the outcome you could expect. I do think that the average patient will have a better cosmetic outcome with silicone implants, but they do cost a little bit more, and there's a little more follow-up involved that you should talk about with your surgeon.
Okay. And I've read a lot on the internet and researching about profiles and textures.
Yeah.
Can you tell me more about that, or should I be worried?
No, I don't. You know, there are a lot of different choices when it comes to implants. You know, there's lots of different shapes and sizes and textures and surfaces and all kinds of things. The information can be overwhelming, especially to a patient. The bottom line, whether it comes, you know, whether we're talking about the texture of the implant or the shape of the implant or how much is in the implant, is that you really shouldn't spend a lot of time worrying about that.
Okay.
I tell my patients, and I tell people when they ask me these questions on the internet, you should spend all of your time and energy thinking about and researching who's going to do this on you. You know, finding a surgeon who is going to keep you safe, finding a surgeon who is going to be able to give you a really good chance of being happy, giving you what you wanted. But don't waste any time doing research on the decisions that really should be made by your surgeon.
Okay.
Right? Yeah. Well, if you choose a good surgeon and they know what they're doing and you chose that surgeon for the right reasons, in other words, because they're a good doctor and they're going to take good care of you, they'll do a good job of helping you sort through all that information.
Okay.
But if you get ideas in your head about what kind of an implant you want before you even meet your surgeon, well, then you might complicate your care and compromise your ability to be happy.
Okay. And Gia, you had your breast surgery. How long ago was it?
I had my breast surgery a little over a year ago.
Okay. And are you happy with your outcome?
I'm very happy with my outcome, yes.
All right. Well, thank you, guys. Is there anything else I should know?
No, I think the main thing is, you know, to spend your time and energy choosing a surgeon properly. You know, choose based on the surgeon's experience, their education, their training, their outcomes, you know, their total body of work, and on whether or not their patients are happy. And if you choose a surgeon properly, the other decisions will fall in line based on the good advice you'll get from them.
Okay. Well, thank you guys so much. I appreciate all the good information.
Okay.
And we'll see you next time.
Okay. Thanks, Amy. That's it. Here's the thing. That's going to depend a lot on the consistency and texture of your own breast tissue, how much skin you have, and it's also going to depend a lot on what type of implant we put in you. So, in other words, saline implants can often tend in women who have a very small amount of their own breast tissue to feel a little bit firm or a little bit like a water balloon under the skin, which is not ideal. Now, if a patient has more breast tissue available of their own to camouflage the implant, then a saline implant might feel a lot more natural. Silicone implants usually feel very natural, very soft, very warm, a lot more like a real breast than a saline implant does. So from the perspective of the feel of the breast, the silicone implant is usually superior, especially the smaller your breasts are.
Okay.
Well, upper body exercise is not allowed at all for a few weeks after surgery, depending on your surgeon's preferences. I usually, if we're putting implants under the muscle, I usually don't like my patients to do upper body exercise for the first 4 to 6 weeks, depending on how they're doing when they come to see me. Now, if you're on a recumbent bike where you're not really leaning forward and bearing weight on your arms, you can go back to that a little bit sooner. But usually I won't want you doing upper body muscular exercise for a few weeks. There's a lot of reasons that I think it's in the patient's best interest to have the implants placed under the muscle. Honestly, putting them on top of the muscle is a lot easier for me. It's less work. I can do the operation faster. The downside is that the implants won't look as natural, so there's a cosmetic compromise that they don't feel as nice because you can feel them through the skin and the tissues. But the worst part is that because they're on top of the muscle and the only thing holding the weight of the implant is the skin and the thin connective tissue of the breast tissue, is that over time the breast will end up looking like you have a bowling ball in a pillowcase. And no woman likes that, and that can be difficult to fix after the fact. So it's usually a lot better from a cosmetic point of view to put them under the muscle, but there are also long-term risks that are lowered if the implants are under the muscle, such as the risk of them becoming hard, the risk of mammograms not being as well done or as careful as if the implant is under the muscle.